Monique Salazar. I'm a fourth-year medical student at the University of Queensland-Ochsner Clinical School. And today I have with me Dr. Anna Suessman, who's our Pediatric Clerkship Director. Can you tell me a little bit more about your role?
Sure. Thanks for having me. So I have the fortunate position to help third-year and fourth-year medical students go through pediatrics. So as many of you know, it's a third-year required clerkship. And during that clerkship, the goal is to be exposed to pediatrics. Pediatrics is huge. There are children's hospitals that are freestanding, and they are full of subspecialties, varied patients, and then you have the outside community physicians, both subspecialists and general pediatricians. And so in the clerkship, students get to go through all those experiences and hopefully solidify their learning of pediatrics in the textbook to pediatrics in real life, in the clinical setting, meet the patients, touch the patients, and decide for them if that's a career opportunity for their interest, that collides with their interests, to serve the smaller, physically smaller humans.
Can you tell me a little bit more? It's a little bit different from when I went through in my third year pediatric clerkship, but can you tell me about some of the changes that have been implemented since then?
Yeah, I'm really excited. I work on a national committee or national group for medical educators in pediatrics, and we want to always advance and keep up with the times, keep up with our learners. So the learners are changing, and boring lectures, that's not something I like to include in the clerkship. I really try hard to innovate our lectures to be very didactic, very interactive, and one of the changes with that is we've now created what's called Ridactics. So instead of go to work and learning clinically and then coming to a lecture and keeping yourself engaged, I've canceled clinic on Fridays, so there's no more clinical experience on Fridays, and now you come in with your classmates and you play you play house. So like the TV show, we are all amazing medical providers, physicians to be, and so I bring up a case and I say, we have a 3-year-old male who put an object up his nose and then swallowed it. And the team goes, and we go from student to student, and they come up with a question about the history or a diagnostic study they want to do, and they have to give a differential with it. So we grow this massive list of differentials. We come up with, well, did he swallow a magnet, or was it a coin, or is it a button battery? And that leads to the next question of, well, how do we get it out? Does it need to come out? Can the child go home? Does it need to be admitted? And there's usually some kind of formality where I'll put up some pictures, I'll add some clinical pearls, but most of it is coming from the students. They're coming up with their own objectives for the learning, and that really, I think, impacts their motivation and their excitement to learn the topic, retain the topic, so that it's easier on exams. Clinically, this semester, I've started, again, for the students to kind of guide their own journey. I think when you have ability to choose what you're learning, what you're studying, what you're exposed to, you become better. So the PEDS clerkship now allows for the students to pick a track. Do you want to do critical care? Do you want to do a procedural track, inpatient, outpatient? And so from these tracks, we try to preference, everyone gets to pick 3. We try to give the first or second choice, and you are then placed in that track. So in critical care, you're going to be in the pediatric ICU. You're going to be with our surgical subspecialists, things that align with critical care medicine. For those in inpatient, you get extra weeks with the inpatient team. You get to see the subspecialty inpatient team, the general pediatric inpatient team. And the benefit of that is that you kind of get excitement for being able to pick your own journey. Every student will still have the same minimal requirements. So every student gets a week in the nursery, a week with inpatient, a week in the emergency department, and then a week with a community general pediatrician clinic. And so that doesn't change. Everyone has very standardized learning, but they have a little bit more kind of like an elective, a choice within the field. And what I've noticed is I think it's impacting people's interest in pediatrics. I think it's maybe solidifying for those who always thought pediatrics was for them. And I'm getting a lot of new faces and new excitement to join our pediatric interest group and to explore the career of pediatrics because they really enjoyed their clerkship.
Before we end, I wanted to ask you, do you have any advice to students that are interested in pediatrics or maybe thinking about pediatrics in the future?
Yeah, I think it's the same advice that I once was told, right? Don't have only one thing you're interested in. And whatever you're interested in, have a reason behind it. What about pediatrics? Because you might come across another clerkship and find that that's the same reason you like another division department. And so staying open, having an open mind, and then enjoying it. It goes really fast. So those who come into the clerkship and they don't like children or they don't like parents, it really puts up a barrier for them to experience the excitement of dealing with parents. I love it. I think it's the best part, right? These are people who, to them, this is their everything. And it is so stressful to go to the emergency room in the middle of the night. And to me, the ability to have an impact, to educate the families, to work with the families for the same exact goal, that's exciting. That's why I love what I do every day. But you have to decide on what do you want to learn or what do you want to end the clerkship with? If you kind of go into it with a goal, you should come out fulfilled, regardless if you decide to go and apply into pediatrics. And for those who know they want to do pediatrics, I'd say find a mentor. All of us in peds are kind and nice and really passionate about our field, so we're always willing to take you on and develop yourself in medical school so that your application standing and status is glorified by a mentor who's giving you research opportunities, giving you educational opportunities, international options. And if you have all that and you're able to do that as a third year, it makes your fourth year really, really great because we have sub-I options in peds and really nurturing your specific goals within your career in pediatrics or any other field.
Thank you very much, Dr. Suessman, and we'll see you guys next time on White Coat Wednesday.
Thanks for having me.